Good evening. Thank you for watching KREX 5 News. I'm Kyra Isaacs. More Mesa County residents are depending on food assistance, especially the SNAP program. But several local medical professionals tell us they worry about the kinds of items that recipients receive or buy with those benefits, including the worst of junk foods and sodas. Our Danny Condon takes a closer look.
We encourage people to have a choice.
Nutritious foods in American grocery stores are often expensive and outside family budgets, especially for those who can hardly afford just the basics.
I was amazed to find organic and great produce and things that I just didn't have the money to buy.
Food banks traditionally have supplied whatever was in stock. The Western Slope director of Food Bank of the Rockies, Sue Ellen Rodwick, tells me how they managed to supply lower-income people with nutritious meals at no cost.
We want to provide those healthy options for people who need it.
Food Bank of the Rockies reports about 30% of the food distributed among the 13 Western Slope counties they reach is fresh produce. About 75% of the food they distribute is considered nutritious, but she admits some snack foods are included.
Something like that could mean the world to them.
Sue Ellen recalls a mobile pantry that offered birthday cakes and the impact of that simple luxury.
This kid, his face lit up as we handed them a birthday cake because he's like, I'll actually get a cake for my birthday.
The SNAP program allows recipients to buy straight-up junk food like sodas, chips, ice cream, and candies, leaving local medical professionals concerned about their increasing risk of diabetes, obesity, and other serious conditions. I asked Jesse Ballman with Mesa County Department of Human Services, who confirmed junk food is allowed as a SNAP benefit, but he also made clear tobacco and alcohol are not. Ballman pointed out SNAP recipients also have access to organic and healthy foods they may not have otherwise, saying they can even use SNAP benefits at local farmers markets.
You know, if people are going to choose healthier options versus unhealthy, we don't control that.
Still, local medical professionals believe if public and health officials work together to address both food education and more nutritious SNAP options, we could reduce disease, create a healthier community, and set an example other communities could eventually follow. First on the Western Slope, I'm Danny Condon, KREX 5 News.